Welcome to the Innovators. I'm Julia Sun. We millennials have a complicated relationship with self-care. On one hand, we are obsessed with wellness. We prefer organic food. We compete with our besties in counting steps with our bling, and we take mental health days. On the other hand, there's something important that a lot of us don't have. And yes, Alex will take health insurance for $1,000 or however more it is for us once we get kicked off our payments plan at 26. Now, according to surveys, the number of millennials without healthcare continues to go up. 1 in 6 these days, and 1 in 5 say routine checkups are out of reach. How do we get here, and what can be done? Here to weigh in, we have our wonderful panel. We have Mairead McArdle, writer of the conservative news magazine National Review, Nate Lerner, co-founder of Build the Wave and Draft Beto, an organization that helps Beto work to run for president, and Pavlina Osta, executive producer of Salem Media Group, which is a radio broadcaster mainly for Christian families. Welcome, guys. I'm going to start with you, Mairead. Healthcare is, I would say, one of the most contested topics in this upcoming election, and people our age, even though we don't call the doctors very often, but we don't want to be left out, right? We don't want to be without a safety net. What do you think the root problem is, and is there even a real fix?
That's a really good question, and I think part of the issue is that the workforce is changing, and in the past you had more people with full-time jobs right out of college. There's an increase in freelancing among young people, and a lot of people who have more than one job. And if you're working 2 or 3 part-time jobs, you're not going to have an employer-sponsored health plan.
The Democratic candidates, they seem to all agree that healthcare is a right, not a privilege, but they have very different ideas on how to put a plan together. What do you think is the best plan that'll cover all Americans, including 20-somethings?
My favorite one is probably Pete Buttigieg's. I love his focus on saying the healthcare government option is going to be there if you want it, but we're not going to force you to get on it. And I think that's a really good plan because you're not going to have the blowback that we saw with Obamacare, where folks said, the government is stepping into my health care and pushing me off. Instead, it's an option that's available for you, and then we can prove that this system works and expand it and lower costs over time, not just force everyone on it right away. But at the same time, I do love what I'm seeing overall from the party and from our candidates running.
And Pavlina, what have you been hearing? Because Obamacare's rollout was not very smooth, right? And some people felt left out. What have you been hearing, and what can politicians do better to help Americans, especially younger Americans?
Right. Well, usually the way it was before Obamacare, you were off your parents' health care by the time you were 21. After Obamacare, you were on the plan until you were 26. I think that actually helped a lot of young people kind of like find their groove and find where they wanted to go in their careers. They were able to get maybe a full-time job, except it's not really looking that way. It looks like like Mairead said, they get part-time jobs, or they're freelancers, or they're consultants. And a lot of millennials, like, the reason they're not opting in to get the health care because they're making around $40,000 a year, and they have a lot of student loans, and they're paying for avocado toast and like other things, you know what I mean? So their priorities have shifted, and a lot of them think that they're healthy and they don't need that option.
Okay, and speaking of priorities, Mairead, I do want to ask you, when it comes to election, how important is healthcare on the echelon of priorities?
I think it's at the top, or one of the top 2 issues, honestly. You see it all the time in the debates. Every single debate, healthcare is always brought up, and I don't think there's any other issue that is discussed as much. And it's interesting to see the different candidates try to figure out where they fall. As Nate was saying, Pete Buttigieg is a little different from, say, Senator Warren or Senator Sanders, and Warren is actually waffling a little bit on whether she agrees with Sanders' plan. So they're all somewhat similar, but there are these small differences in the Medicare for all, or I think Buttigieg is Medicare for all who want it. So it'll be interesting to see where voters fall on that come election time.
And Nate, what do you think about that? Because for voters, as a voter, I care about health care, but I also care about other issues. And even though you agree with Pete Buttigieg's plan on this particular issue, do you think that'll make him a better candidate? overall.
I like to think of myself as a pragmatic progressive, which is why I identify with Beto and Pete. But I do like, what Elizabeth Warren and Bernie Sanders are fighting for, because the argument they're making is that other countries are doing this. They figured this out. Why can't we? And it doesn't make sense that we don't follow a model that we know works. And if you look at the polls time and time again, you see that healthcare is the number 2 or number 1 issue right next to the economy. It's literally the biggest thing in people's lives because it affects their health every day. And if you look at also what's happening in our country financially, 2/3 of bankruptcies are due to healthcare expenses.
Pavlina, I'll give you the last word. How can we make this better for young people?
I think I think that's why young people kind of gravitate towards the free healthcare option, is because that's what they want, that's what they're looking for. As far as the plan for them, I'm not exactly sure what the best option would be, but I think they should opt into having healthcare if they have that option.
Okay, all right, we'll leave it there. Thank you so much for joining me. We'll be back next week with more innovators.